everyone, it's Belinda Kirkpatrick here. I'm a naturopath and a nutritionist, and I've been working in clinical practice for over 15 years and mostly working with women specializing in reproductive health and hormonal health. So one of the conditions I come across on a daily basis in my clinic is endometriosis. Now, endometriosis is an inflammatory condition that with an abnormal immune response. So we used to always think that it was a hormonal condition, but now that we understand it a little bit better, we understand that it's an inflammatory condition that is exacerbated by hormones. So what is it? A lot of people have heard about endometriosis and there's others who haven't. So endometriosis is a condition where cells that should be inside the uterus, the lining of the endometrium, are found outside of the uterus, maybe on the ovaries, the bowel, the bladder, and other structures surrounding your reproductive organs. It can cause pain, it can cause scarring, it can lead to fertility issues as well. Some women will sort of have pain with their period, others will have pain all the month through, and there's often a lot of digestive complaints that go alongside it. Endometriosis, would you believe, takes an average of 8 years to be diagnosed, which is so frustrating for these women who just don't know what's going on. Quite often it's actually diagnosed as irritable bowel syndrome for many years first because of the digestive issues, bloating, gas, constipation, diarrhea that tend to kind of go along with this condition. And those digestive issues and pain may be associated with the menstrual cycle, but they may also be happening through the month as well. It is pretty common. It often starts when you're young, often in the teenage years, and I think around about 2/3 of teenagers reporting chronic pelvic pain eventually do go on to be diagnosed with endometriosis. So that's not to say that everybody with period pain though has endometriosis. So how do we tell, and why is it taking so long to diagnose? That's the tricky part. So I guess when we're looking at endometriosis versus period pain, or what we might call dysmenorrhea, there's a couple of things that make me really sort of pay attention in clinic. So often with endometriosis, the pain might start before the period, maybe even a couple of days or even a week before, whereas usually with period pain, the pain of the period starts on day one. Women who will say to me that painkillers will take the pain away makes me think a little bit more period pain. But those who say that painkillers either don't work or just makes it a little bit more manageable, but they can still feel the pain, makes me wonder a little bit more about endometriosis. So those are just a couple of the things that kind of stand out in clinic. The other thing is that if you've got kind of moderate or severe pain that stops you going to work or school or would stop you from doing something, that's not normal period pain. And you know, really you should be able to have that investigated and hopefully have the underlying cause of that kind of found. Often women with endometriosis will report things like, vomiting, needing to, lying on the bathroom floor, needing to have hot baths, taking time off work and school, taking so many painkillers. And their period really is like a big sort of event, in their kind of monthly cycle. Some women, when the pain has been really bad or the endometriosis has progressed, will start to kind of develop chronic pelvic pain at other times of the cycle as well. Period pain doesn't always affect the bowels as much as endometriosis can, although it's fairly normal to have a little bit of constipation before your period and then a little bit of loose bowels when your period arrives and your progesterone levels drop. So how do we diagnose endometriosis? What do we do about it? How do we know? So at the moment, the gold standard, so the only real way to diagnose endometriosis is via a laparoscopy, which is keyhole surgery. So now you can understand why it does take so long for women to be diagnosed, is that most people aren't just lining up for keyhole surgery unless it's really bad. So there's other markers that can be looked at. There is a specific type of ultrasound called a deep infiltrating endometriosis scan that may find endometriosis only if it's really deep. A normal ultrasound will not show endometriosis unless you've got an endometrioma or some sort of lump of tissue or cyst that makes the ultrasound or the sonographer think that there may be endometriosis there, but you cannot see endometriosis on an ultrasound. So when women come to me and they say, no, I've had all the tests for endometriosis, They might have had an ultrasound and been told that they don't have endometriosis, but that isn't necessarily the case. There is a marker called a CA125, which is an ovarian cancer marker. Sometimes we use that in clinic to sort of get a bit of a guide to see if maybe there's endometriosis there at its lower end of its sort of at the higher end of the normal range. It does indicate that there probably is some sort of inflammation going on in the reproductive tract. Often women don't get diagnosed with endometriosis and have the laparoscopy until the pain is extremely severe, or maybe they've been trying to have a baby and it's been unsuccessful, and then somebody starts to investigate in that way. So what are we going to do about it? Now, luckily for us, the tips that we're going to do between period pain and endometriosis are very similar. So don't worry if you don't have that definitive diagnosis. So what can we do? So brassica vegetables, things like broccoli, cauliflower, cabbage, fennel, spinach, kale, asparagus, Brussels sprouts can help to detoxify estrogen down a milder pathway and can really help. So if those feel okay on your digestive system, aim for a few cups of those every day. We're wanting to be having 4 to 5 cups of vegetables most days if we can. Now, endometriosis, as I mentioned, isn't caused by hormones, but it's like the endometriosis is like the fire, and then estrogen is like the fuel on the fire, or the petrol on the fire. So when estrogen's high, or when we've got a particular type of inflammatory estrogen, that can really fuel that inflammation. So that's why we're trying to reduce inflammation with our tips and diet stuff, support the immune system, but also keep estrogen going down a milder pathway. And that's what those brassica vegetables can do really nicely. You want to try to avoid heating and cooling plastics, so particularly plastics that you eat out of, takeaway food containers, plastic water bottles. Those can contribute to the more inflammatory type of estrogen, so trying to reduce those if you can. Use stainless steel water bottles or glass in the microwave if you are doing any heating and cooling. Try to avoid foods that create inflammation. So we know that dairy, gluten and sugar can contribute to an exacerbation of symptoms of endometriosis. So it's worth just cutting those out for a month or two and seeing how much better you feel. The great thing with our periods is that it is like a monthly report card, and what we basically do in that month will often see an improvement in symptoms in that month. So it's worth having a bit of a kind of a cleanse month to see how your period does go. Reduce and avoid coffee, which can also contribute to inflammation, and maybe replace it with like some dandelion tea or dandelion root coffees, liver herbs, any of those sort of herbal tea blends that you might get at the shops, cleanse, detox, liver. They're all going to be really good at reducing inflammation. Bump up your vegetarian proteins and keep red meat to around about once a week. Favor fish, organic chicken, legumes if you tolerate it as well. Really considering going organic where you can. Obviously that's dependent on your budget and the availability, but if you can, it really does help with those estrogen pathways. We want to increase anti-inflammatory foods, so try to get your fruit and vegetables up to 4 to 5 cups of veggies a day and 1 or 2 pieces of fruit. So really trying to get your veggie intake to be half lunch and half your dinner. Adding herbs and spices, things like turmeric, can be really helpful as well. If you're looking at kind of supplementation, consider a really good dose of turmeric. You might want to look at some fish oils, some essential fatty acids that help to reduce inflammation. Magnesium can really help with pain. Zinc often really helps with kind of period pain as well. You can also kind of look at herbal medicines in combination with a practitioner. They should be probably prescribed a little bit more specifically. And don't forget your gut health. So your gut is really important when we're looking at hormonal conditions. And there's some preliminary research that's looking at the link between, I guess, dysbiosis or bad bacteria and endometriosis as well. So try to improve that gut health, looking at probiotics, collagen, fermented vegetables, kimchi, kefir, kombucha if you're wanting a bit of a treat. So really increasing those ones as well. Definitely if your period pain isn't improving, I would advise that you work with a practitioner, because there's so many herbal medicines and nutritional supplements that can really help with your pain. So I hope this helps. I hope that it's encouraged you to try for a couple of months at least to take on some of those dietary suggestions and see what an impact you can have on your period pain and or endometriosis. Thanks, guys.